Want to stay protected from HIV and other sexually transmitted infections? You're in the right place. In this video, we'll cover how HIV and STIs are transmitted, tools that can help protect you, and where to find free sexual health resources in Rhode Island. You can only get HIV or other STIs from someone who already has an infection. This usually happens through an exchange of body fluids during sex, like semen, vaginal fluid, anal fluid, or blood. Sharing needles is another way infections like HIV can spread. Some STIs, like herpes, can also be passed through skin to skin contact. Here's the tricky part. If your partner hasn't been tested, they might not know they have an infection, and they can still pass it on. So, when you're getting busy with a new or existing partner, here are some ways to protect yourself. You might know that barrier methods like internal and external condoms are great for sex involving the mouth, vagina, or anus. Oral or dental dams can help protect during oral sex. And you may also know that there are vaccines that protect against certain infections like HPV, hepatitis A and B, and Mpox. Now, let's talk about a few powerful tools you may not know as much about. HIV PrEP, HIV PEP, and Doxy PEP. These can help protect you from HIV, and in some cases, bacterial STIs like chlamydia, gonorrhea, and syphilis. HIV PrEP stands for pre-exposure prophylaxis. Basically, prevention before contact. It's used before potential exposure to HIV to reduce your risk of infection. You can take PrEP as a daily pill or get it as an injection from a healthcare provider every 2 months or every 6 months. Depending on the option you choose, when taken as prescribed, PrEP is over 99% effective at preventing HIV. But what if you've already had sex or shared a needle and didn't use protection? That's where HIV PEP comes in. PEP stands for post-exposure prophylaxis, prevention after contact. If you think you've been exposed to HIV, you can go to a clinic within 72 hours and ask for PEP. It's a prescription you take daily for 28 days, and it can significantly reduce your chances of getting HIV. Your provider may also suggest starting PrEP afterward to prevent future risk. Now, PrEP and PEP protect against HIV. But what about other STIs? That's where DoxyPEP comes in. DoxyPEP is a single dose of the antibiotic doxycycline taken after sex. It can help prevent bacterial STIs like chlamydia, gonorrhea, and syphilis. Unlike PEP, which lasts 28 days, DoxyPEP is just one dose after potential exposure. Phew, that was a lot of information. Let's recap. HIV PrEP and HIV PEP both help prevent HIV. PrEP is taken before exposure, while PEP is taken after. PrEP can be a daily pill or periodic injection and is over 99% effective when used correctly. PEP is taken daily for 28 days after a possible exposure and is about 80% effective. DoxyPEP helps prevent bacterial STIs and is taken as a single dose after sex. These tools can be especially helpful for people at higher risk, including those with new or multiple partners, people having sex without condoms, men who have sex with men, trans women, and sex workers. If you're not sure which option is right for you, don't worry. Clinics across Rhode Island and telehealth services can help you figure it out. A provider may ask questions about your sexual activity to recommend the best options for you, so you can have a safe and healthy sex life. To learn more or find services, check out the following resources linked below the video. Visit health.ri.gov/PrEP to explore the Rhode Island PrEP Champions Network for free or low-cost PrEP, PEP, and DoxyPEP. Check out health.ri.gov/your options for a full guide to safer sex tools and download the Right to Know app to learn more about your healthcare rights and find confidential, youth-friendly services across Rhode Island. That's it. Now you've got more tools to stay protected and take control of your sexual health.